Smith as well, and everyone on APPROAPS. I love a good APPROAPS Ways and Means collaboration. But my question deals with what was mentioned related to some of the providers who do not participate in the program. It makes me think about the work that we did on housing, which is, of course, linked to childcare and employment around just discrimination and source of income. And I wanted to get a sense on if there are any requirements around participation, which I assume that there are not, and what do we see as the impact of having some providers who do not participate? What is the impact when it comes to access? Because if we're doing what we should be doing around housing, there absolutely should be individuals who qualify for the scholarship that are located in higher income areas who would really benefit from this. And how does that work when we have potential providers in that area who don't participate in the program?
That's a great question. So the requirements to participate from a provider standpoint in the Child Care Scholarship Program is that they need to be a part of Maryland Excels, which is the state's quality rating and improvement system. So that's the main requirement there. In terms of, I think the supply and demand studies will help us know where we need to increase the number and the accessibility of providers who would take the child care scholarship and greater incentivize it. So one of the things that incentivizes from a business perspective a child care program to participate in the child care scholarship is the market rate reimbursement. And right now we're at the 70th percentile of market rate. We will be conducting a new market rate analysis in the coming month, and that will show us where things have moved. So the last market rate survey that was conducted was prior to COVID, or right when COVID first started, and we know anecdotally that childcare costs have increased since then. And so we do anticipate when we conduct the new market rate survey that the reimbursement rate at the 70th percentile will be higher. And so that might come into a private provider, a child care provider's calculations as to whether or not to participate and offer the program. For instance, if their tuition is higher than the child care scholarship program and their main clientele are higher income, that it may not make sense to them to participate in the child care scholarship program. One of the other things that we're doing to really get ahead of this is we are also conducting a cost modeling feasibility study. Most states are moving towards the cost of care and cost modeling. And that's where we're really looking at all of the different inputs, similar to how we would look at a school and how, we'd look at compensation, we'd look at benefits, we'd look at, high quality early learning materials. We'd look at all those different inputs and we'd look at it by the program size, a large family home, a small family home, a small center, a large childcare center. And we'd be able to come out with a calculation of the true cost of care. And that's something we're in the process of doing as well. So the survey that we're releasing is threefold. It will include the traditional market rate survey that the state has been doing, some cost modeling questions so that we can develop a feasibility study and come back to the General Assembly next legislative session to show you the results of that. And it's also going to include some workforce questions so we understand the current credentials, degrees, certifications that the workforce has. We understand how that relates to compensation. We're able to cross-reference that against specific populations of the workforce. For instance, the Latina women in infant toddler programs. What are their credentials? How are they accessing degree advancement? So this survey is going to capture a lot of that, and it will be able to answer many of those questions in conjunction with supply and demand studies. So we are going to be working with a cohort of counties on conducting supply and demand studies from birth through age 5 to really understand the landscape. What are families' preferences? Are most families preferring family child care? Well, then we need to really focus on helping family child care to grow in certain communities. Are most families preferring a center or school-based program? So there's a lot of questions that we need to answer. And as we conduct these supply and demand studies, we are going to be creating a toolkit so that as we expand to more counties, we're able to conduct these supply and demand studies at a faster clip.
Thank you so much.
Delegate Merrick North.
Thank you, Madam Chair. And thank you, Dr. Cook and Dr. Wright. This is a great presentation. I wanted to go back to the discussion on the copays. Can you help me understand whether a family of 4 is distinguished by whether it's a single income household versus a dual income household? I'm just trying to picture, like, what do I tell my constituents who are, heading their household on 1 income versus 2? Like, what do I tell them in terms of like how much they might spend on this copayment if it were to pass?
Right. So it's based on family size. So the number of children in the family size. So it would be, so say if I said a family of 4, in that example, it could be 1 income household, like a single mother and 3 children. But the key component of it is it's capped so that you're not paying 3% or 7% of your income for each child. It would be total. So there would be some children in your family, for instance, that you would be paying 0 copayment for because you've already hit the cap of the copayment, for instance.
For the other children, is that
right?
Okay.
Correct.
Okay.
So it's less about family composition and more about family size and the gross income. So all of that is adjusted each time the state median income threshold is calculated for that family.
Okay. Thank you.
Thank you so much.
Chair Smith, if you'll indulge me, I have a question myself before we turn back over to appropriates members.
No problem.
This has been just such a huge success. I feel like Delegate Solomon has kind of championed the wins here, as have many other members who are present here today and not. But I think it's worth just reflecting on what went well. And I'm wondering if either of you have any lessons learned from our experience with the child care program that maybe will be applicable as we think about pre-K expansion or other programs that are targeting low-income families in our state. And if there's just anything you've learned that might help us with those programs.
Yes, I think when Delegate Solomon, and I should have put this in the presentation, when he highlighted the advertising, that was just indispensable, I believe. For instance, on the Eastern Shore, there's, one way in, one way out, essentially. We had a billboard there highlighting the Child Care Scholarship Program. It got a lot of eyes on it, given the traffic. This was during the summer. So obviously a lot of folks were traveling. We also looked at census blocks and census tracts where we knew that families would be eligible for the program and targeted mailers to those specific census tracts. We also think that anecdotally, we may have a lot of peer-to-peer sharing of how quickly it took to get the child care scholarship. Now, we have been asked to kind of measure this impact. We are having trouble measuring that impact in terms of who received the mailer, who signed up for the child care scholarship, and is there a direct correlation? So that's been a challenge, but we know anecdotally that we think that has made a difference. Even, you may be driving through the city and you might see on a bus advertisement for the child care scholarship. We've heavily looked at specific bus routes. We put the advertisement on those bus routes in specific bus depots where we know there was a lot of traffic and high visibility. This was similar to what DC did when they were rolling out childcare and universal pre-K. And so we kind of did that same thing as a lesson learned from them. We do think that simplified enrollment through the presumptive eligibility, the fast track child care scholarship really does support families in a robust way, not having to have every single document ready to go right at the beginning, because we know that is a burden on families, giving them that extra time to be able to collect all those documents and submit them for the full year scholarship really was helpful. And I do think finally that it is important that we had key community members sharing this information. Sometimes it's best to hear information like this from a peer or a trusted community member. And so we had childcare resource centers around the state who were able to communicate with families, particularly family resource specialists. It's been a huge help. We've also had specific associations that are early childhood focused that we've partnered with who've been able to share this information. So I think that family engagement piece and having trusted community members share this information has been a huge, huge help.
Are you good? I just want to make sure you were finished with your follow-up. Okay.
Yes, thank you, Madam Chair.
Wonderful. Delegate Woloch.
Thank you, Madam Chair, and thank you to Dr. Cook and Dr. Wright. Very quickly, in terms of the advertising, it seems like it's just a great vehicle to get people into the program, and kudos on all the success. Just wonderful to see. My question is specifically on for parents making decisions about which kind of childcare might be appropriate for the needs of their particular child. So you spoke about informal care, and then there are two types of formal care between centers and then family-based care. Is there, as you're providing that advertising, is there any sort of information on how to make decisions for parents as they're choosing care?
Yes, that's a great question. So the quality rating and improvement system, Maryland excels, is not just for the state to see, okay, this program is rated a quality rating 3, meaning they're high quality, rating 3, 4, or 5. It's really supposed to be an indication to families as well. And there are 2 different websites that families can go to. One is called Locate, and families are able to use that platform to locate childcare. On that platform, they're also able to see the quality of the program, and they're also able to search by different attributes of the program. We also have another website, so we kind of have a no wrong doors policy. So a family might find the Maryland Excels website as well. And that site shows families what's the quality level of their childcare program. It also shows specific badges that a childcare program may receive. For instance, there might be a military childcare. We have a military badge. The childcare might have really good and robust approaches to cultural responsiveness. So we have different attributes that are highlighted on that website, so families can really look and see. They can search by zip code, they can search by a specific area, and really maybe they want a childcare close to their work, maybe they want it close to their home. So they're able to make those decisions and look at the website and really see what's available in their community. Kind of the next level that we're trying to look at and think about is real-time availability, where we can show, okay, this childcare program has 3 slots available, or this family childcare home has 1 slot available. That's kind of the next level of work that we need to move towards. But right now, families can use those 2 websites as a resource, and we actually have some targeted communications, flyers, and other collateral that we're sharing directly with families so that they know about these 2 platforms and can use them to look for childcare that meets the needs of their children.
Okay, great. I see we have, just because my folks have waited a little bit, I want to give Kathy opportunity to get in.
Thank you, Madam Chair.
Delegate Forbes, my bad.
Thank you, Madam Chair. I answered it both. Thank you so much for all the work you did putting this together and all the work you've done to lift up this program. We know it's invaluable to the families you're serving. I wanted to know about if there are rates for families with kids with disabilities, and what your outreach to those families is. Thank you.
Right. So when we conduct the new market rate survey and cost modeling, that will be something that's included because we know children with disabilities may need additional funding and support. We do have several key programs that help connect children with disabilities to childcare, and that is often done through Judy centers, Patty centers potentially, and it's also done through the Maryland Infant Toddlers Program, where they can make those referrals for families. And we also have specific childcare programs that may be therapeutic childcare programs or childcare programs for medically fragile children. And so those are programs, for instance, the childcare resource centers would refer a family to and highlight those specific programs to meet those families' needs. So there are mechanisms through that kind of no wrong door policy that I described earlier to help families connect to childcare programs that would meet the needs of their child. Kind of the next stage of that is, to your point, differentiating pay and potentially adding additional pay for children with disabilities into the structure of the program.
Thank you. I appreciate that answer.
I just want to note that we're entering the 2 o'clock hour, and we still have to hear from the comptroller. So I know that we have one more question, but I just beg that it be brief and the answer would be the same.
Delegate Ebersol.
Always, I try to be the king of the short question. No preamble here. Thank you all very much for being here. Delegate Forbes took one of the two questions I had, and I'm glad she asked it. There is something we approved a couple of years ago called the Early Childhood Mental Health Consultants Group, which will actually send people in. So looking at it from the other side, are we letting providers know that this service is available, that they can use it to encourage them to engage with students who have mental health? And obviously, Delegate Forbes' question was about physical disabilities as well.
Yes, we're so passionate about that program. The Early Childhood and Infant Mental Health Consultants is a huge asset, lots of research behind it. And I will keep it brief. We are promoting that program. In fact, it was shared at a recent state Early Childhood Advisory Council meeting. We're very committed to that work, and we think it's very helpful, particularly for children who are coming out of COVID and may need some additional social, emotional, behavioral supports. And we know that those mental health consultants support both the provider and the family. So huge asset and lots of great research behind the efficacy of that intervention. So thank you for asking that question.
Glad to hear you're on it. I'm really proud of that one. Thank you very much.
And Dr. Cook, before you leave, I just have a question for something you could provide at a later time. You mentioned in your presentation that maybe slightly over 24 states charge a copay at north of 7% of gross income. And I didn't know if you could provide what states those are, because I think it's important when we are doing those type of comparisons, we get a sense of if those are states that have similar goals around expanding access to childcare and other trends around those states to ensure that we're making a useful comparison.
Absolutely, we can get that to you.
Thank you so much, and thank you both, Superintendent Wright and Assistant Superintendent Cook, for your time today. At this point, we'll be moving to the second part of our agenda and welcoming back someone that's half appropriations at heart, and that is our Comptroller, Brooke Learman.
Thank you. Thanks so much for having me. Hello, everybody. It's great to see you all. Thank you, Chair Smith, and thank you, Chair Polakovich-Carr, and thank you, members, for having me here today. That was the policy side in a really interesting discussion. And now I'm going to tell you the operational side of how this program can work. And I think one of the exciting things to me about this work that we've done is what a collaboration it was. And how we actually made government work better for people. And it's so important to pass amazing programs like this. And it's also just as important to make amazing programs like this actually work for the people who you all, when you pass this, and I voted for it too, when we, when we came up with this idea and passed it. So I am going to start by making sure that everybody knows that our agency actually houses the state's General Accounting Division. GAD is what we call it. And it is responsible for getting money out of the door in an efficient and organized manner. And as you can imagine and know, Maryland has a lot of invoices and grants to pay, not just the Child Care Scholarship Program. And the folks in GAD are fantastic. Our director is Sandra Zink. We are very lucky to have her as a state. She came to us from the private sector many years ago. We also have an amazing team, Chris, Sonia, Monica, Darlene, Pat, Mamie, Ann, Dina, Melissa, Teresa, and the aptly named Michael Cash. So I just wanted to give them a shout out because they took this very personally and really dove into the details to get things to work. I also want to put the work in a bit of context. So for the past year, I've been on a bit of an outreach tour with secretaries around the state, including Superintendent Wright, and she and I are going to meet soon to introduce the Office of the Comptroller to our secretaries and explain how we interact. Because in many ways, the Office of the Comptroller is like the spine of the government. You don't see what we do, but if we weren't there, it would all fall down because we pay all employees, we balance the books, and we work with the treasurer to send out payments. For instance, if you're an investor, you go to the Department of Commerce to get okayed for the biotech tax credit, but you actually have to file with us to get your payment. You may be a union receiving a workforce training grant through the Department of Labor, but we're the ones who make sure you get the check. Even our universities depend on the Office of the Comptroller to get payments out the door. Recently, we've been working with UMB and others to help streamline their payments. And you all know the system that we use, FMIS, F-M-I-S, the Financial Management Information System, is very old and very outdated. And so all of our employees, when they're doing this, they are doing it on green screens. And you all passed legislation last year to mandate that we replace it. And we thank you for that. And it will be a years-long process, but it is already underway. As I said, you all passed the scholarship program in 2022. Thank you all for your work in doing this. It is a huge step toward addressing the childcare crisis that is negatively impacting so many communities all around the state. Unfortunately, sometimes passing a bill is just one part of it. And the second part is really operationalizing the actual program. And unfortunately, the Child Care Scholarship Program initially really ran into huge barriers when it came to the speed in which applicants were able to access the money that they were entitled to. And in an industry that cares for our youngest Marylanders and operates with really along the thinnest of margins, days really matter when you're waiting on a check. So I know that many of you heard from constituents and that applicants would not be set up to receive reimbursements or payments. And we know that sometimes it was literally taking months for them to get their payments. Sometimes applicants were getting overpayments and then they were told they had to pay it back, even though they were going to get another payment the next month. Unfortunately, applicants also received some incorrect guidance early on from others, which created mass confusion and resulted in many applicants taking duplicative efforts and creating confusion and a real backlog for the program. Our office was inundated with calls and emails, and the outreach volume doubled, and our team was really unable to keep up with the demand, especially as it can be a complex system to navigate. It wasn't even the application itself, it was just the verification of the requirements that could be difficult to navigate, as well as setting up payments for accounts or direct deposit. And even though this is a program administered by MSDE, our office would receive the calls and emails from applicants, sometimes really desperate, really, really tragic calls wanting to know when they would receive their payments. So before the issue was resolved, we literally had members of our team at times hand deliver checks, like leave our office at the end of the day and drive by people's homes to give them their checks. One of our team members brought groceries for several families because in the course of working to help them receive their payments, our staff learned about the situation that the applicant was in and that they did not have enough money to afford groceries that week because they had not received this payment. And finally, just it was untenable, like it had to be fixed. And so we knew that it could be done more efficiently. And I think our partners at MSDE knew that too. So earlier this year, we reached out to our MSDE partners and asked them to share with us their processes for administering the program, including the process for reviewing applications, the data they were collecting to verify applications, the way they were transmitting data to our office, requirements they were giving to applicants for reimbursement, and the frequency in which we were receiving transactions. Our team then conducted a process review and identified numerous recommendations to improve the process and the portals. First, we integrated all these payments into an existing interface that we previously established with MSDE so that we could save time and resources. We also developed a new process for getting updates onto forms, and that saved a significant amount of time and was really critical for data delivery. We also then worked with MSD staff to train them on what data was needed so they weren't asking any of the applicants for unnecessary data, which just clogged the forms and confused things. We also showed MSD how to pull data at a much more frequent interval, and that allowed us to isolate the payment transactions so we could expedite them by 11 a.m. each day. So MSD would pull them, they'd transmit through, and we could pull every day at 11 a.m. We also helped in the role of program navigators for applicants, actually walking folks through parts of the process to make sure that they were set up correctly to receive payments. And we expedited those payments to ensure we could move money quickly. You know, this is also a really organized community, the providers and parents. And when word got out that we were able to help, many of our direct lines, like of our staff, GAD, those names I said early on, many of their direct lines were then shared in Facebook groups. And so our phones just lit up. And our team was really happy to help, but it was and is an incredibly major undertaking. And that was on top of every other payment that we are processing on a day-to-day basis. Our GAD team is an incredibly dedicated group of individuals, but very small for a state our size. So in other words, the comptroller and MSDE teams really collaborated behind the scenes to solve what was a really big problem that was having a big impact, negative impact on families and providers, and it's made a huge difference. And we continue to work collaboratively to further improve our processes and to clear administrative hurdles so that people can get their checks as fast as possible. And while this is a special case, our GAD team is in constant communication with other agencies around the state. And we're always looking for ways to provide feedback and guidance to ensure other agencies can manage our admittedly complex payment system and an outdated payment system to make sure that the programs that we are administering as a state are able to run efficiently. So I just want to highlight briefly what I think this story is about. I think all of you as folks who work in money in government, especially, appropriators, you are dealing with our agencies every day, Ways and Means, you're seeing the money flow through as well. There are some micro lessons to be learned, including around ensuring applications are not overly complex and that guidance is clear and correct. But at its core, I also think this is about allowing individuals in government to collaborate and to be thoughtful about how they work with one another. It's really, it's a true success story, I think. We've also realized that if we as a state are going to invest tens of millions of dollars into a brand new IT system to replace FEMIS, that we have to change our process and ensure that every financial officer in every agency is trained well. So as part of our larger program to replace FEMIS, we're actually taking two tracks now. One is about the new IT system to replace FEMIS itself and get off those green screens. But the other one is about people. So we are creating now an accounting academy for the state of Maryland. We've already hired a woman, Victoria Steger, to assess the needs in every agency around the state and every university to see what's working and where the challenges are in those agencies and what the level of understanding is. And then design and write a curriculum that we will set up for teaching and training so that we will be training all the finance team members in every agency of the state. So many other states have invested millions and millions of dollars into a new IT system, only to have the entire system fail because they did not bother to take the time to train the people who would be working in it. So we are starting now to ensure that all finance employees in every agency and university understand our systems, and then we can bring them along into the new system in a few years when we bring that system is. So I just wanted to put that in a little bit of context and say, we've learned too how we can better support agencies and the state as a whole moving forward. So I continue to take away from this collaboration just the need to ensure we invest in our state workers, to remove barriers whenever we find them, and to encourage collaboration and the free flow of information. We just cannot work in silos. And so I continue to remind and love working with our agency secretaries to make sure that we're supporting the programs that they are implementing that you all have created through legislation. Childcare is very, very important. I'm not going to get into it now unless someone wants me to, but we spent a great deal talking about some of the challenge in our labor force in our recent State of the Economy report. And, I think we all know intuitively how important childcare is, and we solved it there. So thanks so much. And I'm happy to take questions.
Madam Comptroller, actually, that's part of the reason why we wanted you to be here today.
Okay,
because
talk about
it's not
that.
just about the efficiencies behind the delivery, the funds, that's obviously a point you're critical around, but this is a landmark publication of the Comptroller's office. So I want to make that clear, but I want you to unpack further what childcare means.
Absolutely. No, you don't just want to hear about the Accounting Academy.
I love a good academy, so kudos.
No, I really appreciate that. And you're right. We're really proud of the collaborative work that we did as an agency to create the State of the Economy report. Just so everybody knows, last March, when we met for the first time as a Board of Revenue Estimates, I saw that our revenues just weren't growing at the rate that I thought that they should be growing. And so we started doing a little bit of a deep dive. We talked to, of course, the BRE, we called the Fed, we talked to a number of partners, and especially at the Fed, they said, really get out of the office and start talking to people more. So we took two tracks. First, we sent a team of people out and we held roundtable discussions with hundreds of business leaders and economic development leaders around the states, from Frostburg to Salisbury and north to south. And then we also looked at the quantitative data that we have access to, both our in-house data, Bureau of Labor Statistics data, and more to produce. And that is what we ended up using to produce this State of the Economy report that we published on January 3rd, and that you can find at marylandtaxes.gov, right on the front page. So brief synopsis, in short, we have a resilient economy with an incredibly strong foundation and unique and incredible assets, right? From the Port of Baltimore to the number of universities we have, the military installations, the 60 federal agencies in the state of Maryland, and of course the FBI to come. But despite all of that, we are facing challenges. The labor force, one of the key reasons that we've seen the private sector job growth stagnate in the state of Maryland is that we have seen our labor force participation rates stagnate. In fact, our private sector job growth has slowed since even before the pandemic. And we have also seen our labor force participation rate slow down since the pandemic as well. So our labor participation rate in Maryland fell 4% between 20 and 23. We have one of the highest labor force participation rates in the country, but it is lower now than it was before the pandemic by about 4%. That difference reflects about 181,000 people no longer employed or looking for work. And the decline was felt most prominently among 25 to 44-year-olds and women, and among women as well. So across the nation, we saw women leave the workforce at a higher rate because many of their jobs in the service industry, food industry, and more were jobs that we lost during the pandemic. However, women came back after the pandemic, and they did not come back at the same rate in Maryland as they came back nationally. Across the country, 1% of women left the workforce, but in Maryland, 2% the losses were women. So we go on in the report to talk about, why it is that some women may be staying out of the workforce. And I should say the out-of-home workforce, right? Because of course, one of the reasons that we believe women are not in the out-of-home workforce is because they are working in the home. We have seen childcare escalate in costs throughout the state of Maryland. And in fact, we have one of the highest costs of childcare of any state in the country right now. So there are a number of other reasons women may have left the workforce, including expanded entrepreneurial efforts and more. But certainly childcare is something that we believe is essential to ensuring that we can return to our high labor force participation rates, and that we can ensure that women can re-enter the workforce as well. And finally, I'll note one other issue that we saw, and that is our folks moving from high cost of living areas to low cost of living areas. We have seen this we are having folks from New Jersey and New York and DC move to Maryland because we're a lower cost of living state. But we also have seen many people leave Maryland to go to other states that are lower cost of living. And I think in every single roundtable discussion we had, and then as well looking at the data, one of the key pieces of that cost of living is the cost of housing. And so taking sort of childcare issues and housing costs together, you're seeing that this high cost of living is really challenging to both for employers because they cannot lure people from other states into Maryland. And it's making it harder for that 25 to 44-year-old demographic as well to plant roots, be able to afford a house, also think about affording childcare and more, and to stay here. So happy to, of course, share more information with you, but those are some highlights, and I appreciate you letting me be here today. Thank you.
I don't see any questions. Do you have any remarks, Chair Polakovich-Carr?
Thank you, Chair Smith. No questions. Wanted to thank Comptroller Learman for being here and for the comprehensive information and just the transparency on, what's going on in terms of the payments. And we very much appreciate that. And just, in fact, how much you were before Ways and Means and your staff are so accessible on all of these issues. So thank you on all those fronts.
Thank you. We appreciate it. And thanks for the partnership. Thank you.
Yes, thank you for your leadership around leveraging technology to bring the Comptroller's Office into the 21st century, and for the landmark report. That's really great information for us as policymakers to have. So we thank you for taking the leadership on that. And we are proud of your academy for accounting. We really are. Very important. I believe that concludes our hearing for today. And I just want to thank every participant from both committees for being here. And as a former Ways and Means member and now a probes, I feel like all my family members are with me at once. It's always very lovely. And so without further ado, I think we can conclude, and I do wish you all a great rest of your day.